This is a research article in a journal called Musculoskeletal Disorders, and it's called Absence of Pain in Subjects with Advanced Radiographic Knee Osteoarthritis. What does that mean in plain English? It's a study on a whole lot of people who have no knee pain. All right, so they had x-rays, ultrasound scans, MRIs, and a whole lot of them had right up to grade 4 osteoarthritis according to the scans, which means very, very reduced cartilage in their knees, to the point where that is the level that doctors recommend knee replacement surgery. And yet none of these people had any pain. Welcome to Shape Fixer. I'm Andrew. I'm a nutritionist. I'm also a sportsman and a coach and a science and biology teacher. And I've had my issues with joint problems and diagnoses that don't make sense. This is similar to studies I've seen before on discs in lower backs, studies on hips, and so it all relates to the fact that whenever you have pain in a joint, hip, knee, shoulder, between the vertebrae in your back, and you go for a scan and the scan shows some level of reduction in the cartilage layer in the joint, immediately the medical brains shut down and you're told you need a replacement surgery on that joint, whether that's an artificial disc or a hip replacement, or in this case, a knee replacement. But the fact that so many people show level 4, that's the top level, that's the worst case osteoarthritis, level 4 without pain, I have two questions. One is, why do you need replacement surgery if you don't have any pain? No, obviously you don't, because if without any pain, you never went to the doctor and you never got a scan anyway, and it has never occurred to you. So it's unlikely that anyone with no pain is going to end up having a scan and having a joint replacement. So that's fine. But the fact that they jump on degraded cartilage every single time when there is pain is suggesting that there's nothing else in your hip. There are no muscles, there are no tendons, there are no ligaments, there are no nerves, not in your hip, in your joint. There's nothing else there that could be compromised or inflamed or damaged and causing pain. No. If you've got pain, it's your cartilage. But we've seen from studies like this that thousands of people have reduced cartilage and they don't have an issue. So if something else is wrong, like a pinched nerve or a torn muscle or some scar tissue from an old injury or damaged ligaments, and you happen to be one of those people who has degraded cartilage as well, you are going to be sent for a joint replacement. And this is insane. And in fact, without reading through all these 9 pages of this report, just the conclusion, I'm going to read you the conclusion. And remember, this is about knees, because this particular study was on knees, but there's a study on hips, there's a study on spinal issues. This can apply to any joint in your body. Our study showed that a considerable number of subjects with grade 4 osteoarthritis did not report pain. In patients whose pain arises from causes other than structural damage to the joint. In other words, you could have a pinched nerve, or you could have a damaged ligament, or you could have a pulled muscle. Therapeutic decision based on the knee x-ray could lead to suboptimal results, or that's putting it mildly. Treatment options focusing solely on cartilage engineering, which is what joint replacements are, should be viewed with caution. And I cannot echo that enough. because I am in a position at the moment where I have a very similar issue. I had an accident on my bicycle, or a truck pulled out in front of me, and I went down really, really hard on the tar, and I landed on the outside of my left hip, on the greater trochanter of my femur. That's that bony knob on the side, sort of on the side of your ass, and that bony protrusion is called a process. It's a rounded piece off the side of the bone, which is there for muscles to attach to. So muscles attach to bones with tendons. So you've got these tendons coming in and knitting into that part of the bone. And there are several muscles that connect onto the trochanter. I landed on that. It was indescribably painful at the time. I went for x-rays. Nothing was broken. Okay, fine. But that's all the x-rays looked at, was looking for broken bone. Then I was sent home to recover, which I kind of did quietly with anti-inflammatories and a bit of rest. But it's not been the same since. And this is a long time now. And I can cycle, I go to the gym, I'm pretty active, but I have a bit of a limp from time to time, and some days are really unpleasant, other days are fine. Running is difficult because I have to warm up. It takes me about a half a k to a k, to warm up before it gets comfortable, and then it's comfortable, then I can run, then it's fine, but it's always really annoying. And the pain is sometimes in my glute, in my ass, sort of high up towards the outside. Sometimes it's on the side where that bone is, sometimes it's down my side of my thigh, and even down my hamstring, down to behind my knee. So that would suggest that there's a nerve involved, and that would be the sciatic nerve, and a lot of people have sciatica. The sciatic nerve comes out through the sort of hip area and goes past the piriformis muscle, excuse me for all this technology, and the piriformis muscle is one of the muscles that attaches onto that trochanter. So I suspect I damaged the muscle. It cost me some stability and some balance. There's now scar tissue there. It's impinging on the sciatic nerve, and that's why I get this pain. And this explains, firstly, why the pain seems to move around, and secondly, why it eases when I exercise. Because when you exercise and you've got nerve and muscle, soft tissue issues, as you exercise and you warm up, it sort of loosens everything up. You generate a bit of blood flow. It sorts itself out. It doesn't hurt so much, and then it's fine. I'm trying to get the medical system here, I'm trying to get them to do a proper MRI on that area to see where the damage is, to see if it's the piriformis muscle or the gluteus medius, or if there's a tendon that's actually disconnected, or if there's just scar tissue that can be cleaned out. What is going on here? And guess what? Doctor sent me for a scan, not an MRI yet. I'm campaigning for that because that's what I need. Firstly, just ultrasound, okay, an ultrasound scan. And the first thing they saw was that the cartilage in my joint is quite worn away. I mean, it's quite narrow. I'm 62. It would be a bit narrower. I used to have arthritis in that hip. So there's a history there. And the blinkers are on. I'm told the pain is because I have osteoarthritis. It's not. Because it's not. It doesn't hurt in the joint. It doesn't hurt in where the bones articulate and where the pain would be, which is typically sort of the front of your hip in towards your groin. That's where you feel the bone-on-bone pain of osteoarthritis. I never feel anything there, not even every now and again, nothing ever. It's on the outside, it's higher up on my glute, or it's down my leg, down my thigh, behind my hamstring. It's the nerve. And the nerve, that nerve doesn't run through the joint, for heaven's sake. It runs around the back of your hip, between all your bum muscles and around the piriformis muscle. That's where the pain is. But the doctor is not listening or not registering what I say about my symptoms. She's just looking at the scan and going, your cartilage is degraded, you need a hip replacement, that's why you've got pain. Next patient, please. And that's what this is talking about. This is ridiculous. I don't have pain in my joint. So be very, very careful. If you do have problems with any joints anywhere, try to get, I know it's not always easy, but you really want somebody who's going to look at it and take it all into account, not just somebody who thinks hip replacements and knee replacements are the solution to everything, because they're not. I mean, they are if you really need that. And of course, there are cases where that is a very useful procedure, but it's highly invasive, very expensive, and very often completely irrelevant. It's not necessary. So it's nice to see that there are these studies out there, and I don't know how many doctors look at them. I suspect not, certainly not enough. But this is a real issue that, and I heard somebody say this a little while ago, that doctors need to treat the patient, not the test. So they look at a scan and they jump to conclusions. They look at a blood test, they jump to conclusions. They see high LDL, oh, you need a statin. No, it depends on the other numbers in your blood test. It depends on your lifestyle, on your diet, on your body weight, on a whole lot of other things. They need to look at you, and they need to talk to you, and they need to understand your symptoms and your experience, and because that is the context for what comes up in the test. But they don't, or too often they don't. So try to find a doctor who does, or at least go to another doctor and get a second and maybe even a third opinion. Find one that will have a conversation with you. If your doctor's prepared to have a conversation and listen to you and ask you questions rather than just making you be quiet while they talk to you, you're more likely to have somebody who's actually going to be on the right track and get you the right diagnosis and the right treatment. You need to be a team. Remember, this is your health. Okay, it's not your doctor's health. It's your health. And it's studies like this which are so incredibly valuable. Scanning people who don't have pain, and oh look, they all appear to have osteoarthritis, but it's not an issue. Just be careful. Make sure your doctor is treating you and consulting to you and asking you questions, and not just looking at some kind of laboratory test, whether that's an x-ray or a blood test or whatever it is, looking at a test and then it's a sort of paint by numbers. This number's high, therefore this is wrong with you, therefore go and fix that. Because it might not be that. Okay, it might be coincidental and irrelevant, or it might be something of part of a bigger pattern and they need to be looking at other things as well. You want your patient to deal with you, not with just an x-ray or some kind of test. So thank you for our time. Please subscribe to our channel. I'm going to put a couple of videos down below here that I've made about hips and knees and exercises you can do to try and ease the pain in your joints to avoid going for a hip replacement, and also, very importantly, diet. Nutrition is absolutely key to controlling inflammation and for promoting healing. And a very special video just explains how cartilage actually works and why you can regenerate the cartilage in a joint, contrary to what a lot of people will tell you. So look at those videos. If you are having a joint problem and you are faced with the prospect of major surgery, please try and understand it first. Okay, watch these videos, this short list of videos down below here. Subscribe to our channel, become a member of the channel, because then you have access to additional content, and even go to my website, www.shapefixer.com. There is quite a lot of material there about joints, hip joints in particular, and I even have a course that you can download that doesn't cost too much that will help you with a 3-month process to try and recover so that you don't have to have a joint replacement. Thank you again for your time. Please subscribe to our channel and we'll see you back here for the next video.